Poverty and negative social practices have been identified as major hindrances to zero dose of immunization in the Northeast. This has heightened the concern of UNICEF in recent times. Speaking at this event, the Chief Bauchi Field Office in her presentation explains how hygiene and immunization can heal and prevent the spread of diseases.
I have arrived. I see that still in Nigeria, more than 1,000 mothers out of every 100,000, they die because they don't get appropriate pregnancy care and delivery care. So this is a huge number when you will see out of total population, how many women dying every day, every hour, every minute. It is a crisis for us.
Meanwhile, the authority of Taraba State Primary Health Care, in an interview with TVC News, says the state government achieved the feat through UNICEF Gavi Mama to Mama initiative.
By and large, this MOU has given Taraba State a platform where we've had a very good, we have a very good coverage. And how do these vaccines also get to communities? This MOU, we have from outside. If you go outside, we see 3 Helios vehicles that was purchased by UNICEF through this MOU. Vaccines for vaccines push from the state capital, from the state called store to various local government and even down to facilities.
These group are members of Mama to Mama members in Gombe and Taraba State, and they share their challenges with TVC News.
Mama to Mama has been successfully because initially, before, the women don't come to the clinic. But now we have almost about out of 100%, we have about up to 85 to 90% women that visit the clinic for the ANC and for immunization of their children and for treatment.
It is believed that with good policies and investment in health, all children's lives will be saved in Nigeria.
Right. So we were just, that report that you saw is going to set a tone for our conversation on health, and that's the issue of the primary health care. As the United Nations Children Fund calls on governors in the Northeast to strengthen the primary healthcare system and intensify immunization of children against killer diseases. Of course, we also heard from the UNICEF Chief Bauchi Field Office, Dr Nazhat Rafique, who says Taraba State governors is doing well on child immunization. And Dr Nazhat Rafique is with us on the program this morning to talk about progress that have been made in Taraba State. We also have joining us via Zoom the Executive Secretary, Taraba State Primary Healthcare Development Agency, Dr. Tukura Nuru. Thanks a lot, ma'am and gentlemen, for joining us at this point. We appreciate you both. Let's begin with Dr. Tukura Nuru. The indices that we have seen in Taraba State regarding health and how accessible healthcare is for residents are quite worrying. There's so many issues to talk about, but with this intervention, UNICEF, help us explain how far it's going to help and meet the gap in your state.
Thank you for having me this morning. Thank you, viewers. In Taraba State, we have a memorandum of understanding with Gavi, Global Alliance for Vaccine and Immunization, and which UNICEF is implementing in the state. Taraba State being the 8th state, among the 8 states in Nigeria that are having this, that signed this MOU in 2021, and the program we started implementation in 2022, specifically in April. So far, this MOU has strengthened our primary care system in the states, and this can be seen in various thematic areas or pillars. One, in the area of human resource for health, when this program kickstarted, there was an engagement of 300 community health extension workers to bridge the human resource for health gap in the states. And this has improved the service delivery across the states. So far, before this implementation started, in 2021, for instance, our Penta 3 coverage, which is one of the vaccines we use, it was at 68.4%. But presently, as we speak, the year has not run out, but we're at 80% coverage, and the national target is 85%. That is for 2024. So before the year runs out, we are expected to surpass the national target. And also, in area of service delivery, because of this MOU, 168 motorcycles have been purchased and distributed to various to routine immunization officers in various wards. We have 168 political wards in Taraba State, and by extension, we have 168 primary healthcare centers, one per ward, that is being upgraded in terms of infrastructure, in terms of human resource for health, in terms of commodities, vaccines, and other consumables. So 168 motorcycles being provided and logistics to support this mobile outreach that goes to various communities. In fact, it is of interest to note that Taraba State, 36% of the Taraba State landmass is either hard to reach, difficult to reach, difficult terrain. So we are not surprised with what the result, the achievement that the primary care has recorded. And in area of supply chain, there is improvement in vaccine storage capacities in the state through procurement, installation, and regular maintenance of solar direct drives. These are solar refrigerators that are meant for storage of vaccines. As I speak, we have more than 200 solar direct drives that have been installed across the states. And maintenance.
Dr. No, we can continue with some of the achievements made concerning this children immunization. But let me quickly bring in UNICEF into this matter. How is UNICEF partnering with states like Taraba to ensure that the public health is getting to the people at the grassroots? Looking at the northeastern states at the moment. So how is UNICEF being able to partner with this state to ensure that this public awareness on immunization is getting to the people at the grassroots?
Dr. Rafique.
Are you there?
Good morning, colleagues. Thank you very much for this opportunity today. And I think this is a very important MOU between UNICEF, Gavi, state government, and overall guidance by the Federal Ministry of Health of Nigeria. And as Dr. Tucker has very nicely explained what this MOU is and how it has been contributing towards improvement of primary healthcare services in Taraba State, I think this is one of the key area that child immunization needs to be improved under this MOU, along with other reproductive health, maternal, newborn, child health services, community mobilization, creating demand and awareness, and outreach services, as already explained by Dr. Tucker. I would like to talk about child immunization because that is a flagship program of UNICEF, and under this MOU, it has also a very clear vision and has been prioritized. This child immunization, there are many aspects. One is that we need to reach every child. So under this MOU, we have been able to achieve the elimination of zero-dose children in Taraba, and it is a very big achievement, one of the very few first states where we have achieved it. Zero-dose child means that the child has never been approached or accessed any immunization services. There has never been any shot given to that child, and we call it zero-dose child. And that is something which is the most critical thing, that it shows that the most vulnerable child has no access to immunization services. And PHC being the closest to the communities, to the people, to children, if we strengthen PHC, it means that we should be able to reach every child. Our child should be able to come to the health facility and receive a dose of immunization, in routine immunization. So through our outreach services, effective vaccine management, transportation, decentralization of vaccine storage at the LGA level, reaching the communities with the services through our trained human resource, the vaccinators. I think that has been a key success of this MOU since May 2022, when this MOU started being implemented in Taraba. And now we don't have any zero-dose child in Taraba. But at the same time, we have to improve, as Dr. Tuka said, that the fully immunized children, we cannot stop at 1 dose or 2 doses of immunization. A child has to get the whole routine immunization, complete immunization, and that we call fully immunized child. Right. That prevents the preventable diseases. All right. And that has also been increased from 49% to almost 80%, more than 80%. And
Dr.
that has
Nazhat,
been also one of the
Dr. Nazhat, well, thanks a lot for the opening remarks. And of course, you've spoken about how we're no more getting the zero immunization in Taraba State. But what's the sustainability plan of this program?
Please, I'm not able to hear you clearly.
What's the sustainability plan for the program?
Yes, of course, yes. I think sustainability is the backbone of any program, and with state government, which has, very impressive commitment to this program, and I really want to appreciate His Excellency Deputy Governor, who has been the lead on this MOU and chairperson of the committee who is taking care of this whole program, and they meet quarterly and they guide and lead the program implementation in Taraba State, and especially because National Ministry of Health at national level and this National Primary Healthcare Development Agency, they have their National Immunization and Primary Healthcare Strengthening Strategy, and all states, they plan their annual work plan in line with that. And now also Federal Ministry of Health has integrated SWAP, sector-wide approach. So according to those guidelines, Taraba State has also developed its operational work plan for 2025. And all these initiatives under this MOU, they have been very well absorbed in that operational plan. And they will continue in Taraba State. There has been commitment by the state government to continue these initiatives and allocate funds for it, especially. And that is very, very impressive and highly appreciable, because until or unless this journey continues, the achievements so far cannot be retained and improved further. So with this commitment of the state government, UNICEF technical support, and all the support to continue in terms of demand creation, social mobilization, outreach services, vaccine provisions, all these things goes hand in hand with the state government of Taraba, and Gavi support, which is almost completing now this year. We have set up a momentum. We have initiated something that can go a long way in achieving a very strong public health system in Taraba. So it is going to be sustained with the commitment of all partners, the state government, UNICEF, federal ministry guidelines, community leaders, religious leaders, and communities themselves who have become, more aware, but this journey needs to continue.
We appreciate that fact. It's going to be sustained, talking about the children immunization, especially there in Taraba State. But let me quickly come to Dr. Nuhu. what is the age range for the complete dose of this children immunization, and how is the state government going around with sensitization and creating more awareness for residents of that particular state?
Thank you. For us in Taraba State, and by extension, that means Primary Care Development Agency, we have community component of demand generation. You have to create demand for the services you are going to render. Otherwise, people will not take those services. For instance, in the community, we have what is called Mama to Mama, which is an initiative that this MOU has brought on board. And in Taraba State, each of those wards, we have 30 women that come together. It's a voluntary organization. Instead of discussing issues that are not health related, they are brought together, they are enlightened, they are sensitized, they are mobilized, they go from house to house, community to community within their own political wards to mobilize women to go and take service delivery. As we speak in the state, for instance, these women, Mama to Mama, they've referred, they've tracked, they've counseled women on complementary feeding. We have over 127,000 of complementary feeding that Mama counseling that Mama to Mama has done in Taraba State. And we also have the under 5s. Those without birth registration certificate, they are tracked and referred to health facilities so that they can be registered, and we know the importance of birth registration, which is a vital statistics. And we also have those that have dropped out along the way during the immunization process. They've tracked over 83,000 and referred them back to facilities to get immunized. Just as my colleague from the UNICEF said, we don't want to have zero-dose child or children in any community. So apart from what the Mama to Mama they are doing, we also have what is called CHIPS agents. This CHIPS agent stands for Community Health Influencers, Promoters, and Services Agents. They are also in the communities where they go from house to house in the community. Mm-hmm. They mobilize women too, and there are issues. For instance, there are cases that they can manage. For instance, if children are vomiting, they can manage it, or diarrhea, for instance, where they offer ORS. They taught the women how to prepare ORS and also to give zinc tablets. Apart from things like diarrhea, they also treat minor illnesses like simple malaria and make referral where it is appropriate. So in terms we are doing very well in terms of community mobilization, community sensitization, because of the services that we have in the state that women, children, and people in those communities should go and assess.
Dr. Nuru, that would be a fine place to leave our conversation this morning. We thank you both profusely, Dr. Nazhat Rafique, the Chief Field Office, UNICEF Nigeria Bauchi Field Office, as well as Dr. Tukura Nuru, who is the Executive Secretary of the Taraba State Primary Health Care Development Agency. Many thanks once again to you both.